Hi, I'm Robert Smith. The third edition of my book, Medicinal Chemistry, Fusion of Traditional and Western Medicine, has been published. It can be used as a textbook for the second semester in a two-semester course in medicinal chemistry. The second edition can be used for the first semester, while the first edition is for a one-semester course. The third edition begins with a chapter on personalized medicine and targeted drug delivery. Perhaps nothing epitomizes the fusion of traditional and Western medicine more than predictive, preventive, personalized, and participatory medicine, also known as P4 medicine. It takes not just a holistic, but also a quantitative and mathematical approach to practicing medicine. Personalized medicine is designed for the specific genetic, epigenetic, and environmental properties of patients and their diseased cells. Diagnoses, treatments, and cures are improving for diseases caused by a single gene. Instead of just making the medicine specific for the DNA that a person is born with, it can be made specific for the mutated DNA that is in a type of cancer or other disease. The next chapter is on inflammation, which can be a cause or symptom of many diseases. When controlled, it is also an important part of maintaining good health. Smoldering inflammation is a relatively low level of inflammation. It is a significant factor in many diseases. For example, it plays an important role in all stages of atherosclerosis and cardiovascular diseases. In many cases, these and other diseases caused by smoldering inflammation can be prevented by avoiding obesity, trans fats, and saturated fats that are in the typical fast food diet that many people in the United States consume. Instead, unsaturated fats are much better. The next chapter is about metabolic syndrome, diabetes, heart disease, and stroke. All of these involve imbalances in energy metabolism. Early symptoms of metabolic syndrome include excessive weight, high blood pressure, elevated blood glucose, and elevated levels of lipids, especially low-density lipoprotein. People who have two or more of these symptoms are at a higher risk of developing heart disease, stroke, and type 2 diabetes. Childhood obesity is such a big problem that it will probably mean that this generation will be the first to have a shorter life expectancy than their parents. Cancer, which is the subject of the fourth chapter, can be caused by the typical American diet that leads to obesity. Cancer is not just one disease, but a group of very different diseases. The hallmarks of cancer are inflammation, chromosomal defects, genetic instability, escape from immunosurveillance, limitless proliferative potential, self-sufficiency in growth signals, insensitivity to anti-growth signals, evasion of apoptosis, sustained angiogenesis, tissue invasion, and metastasis. Moreover, reactive oxygen substances such as the hydroxyl radical that is produced by poorly liganded iron can cause oxidative damage to DNA, proteins, and lipids, affecting the genome, epigenome, proteome, and lipidome. So, multivitamins for men over 50 do not contain iron. Also, mutations accumulate as we age, eventually leading to new cell surface antigens being made. They can change a tumor's interaction with the immune system, enabling it to escape immunosurveillance. Then it develops limitless proliferative potential as it becomes self-sufficient in producing the growth signals it needs and becomes insensitive to anti-growth signals. Finally, a tumor becomes deadly when it builds new blood vessels and metastasizes into lymph nodes and other organs. The fifth chapter is about the medicinal chemistry of the endocrine system. Unlike older books on medicinal chemistry, my book includes the stomach, duodenum, liver, pancreas, and kidneys as part of the endocrine system, since they all secrete hormones. Of course, the other parts of the endocrine system, such as the hypothalamus, pineal body, reproductive system, thyroid, pituitary, and adrenal glands, are also discussed. The sixth chapter is about the reproductive system and osteoporosis. It includes a discussion about bioidentical hormone therapy, which has become quite popular and the subject of best-selling books by Susan Summers. However, one of the major objections to the use of bioidentical compounded hormones in most of the previous peer-reviewed articles on this subject has been that there are no guidelines for doses because pharmacokinetic studies have not been done. That changed in 2013 when a pharmacokinetic study was done in a randomized, blinded, 4-arm, 16-day clinical trial of 40 postmenopausal women. Similar studies are being done at the Mayo Clinic. These are discussed in this third edition. The 7th chapter is about the medicinal chemistry of the nervous system. The first year of life is critical in brain development. This is when the brain is most susceptible to damage by genetic defects and environmental insults. It is also the time when therapeutic intervention can have its maximum effect. This is discussed, and different parts of the nervous system are described, along with diseases and ways to treat or cure them. The 8th chapter is about the immune system or immune network. It recognizes and defends us against internal threats caused by invading organisms and pathogens. It is also crucial in preventing the spread of cancer cells as they enter the bloodstream. This can prevent them from becoming deadly metastases. The 9th chapter is about infectious diseases that can be caused by worms, protozoa, fungi, bacteria, viruses, or even proteins or prions. It discusses ways to prevent and treat them. This is continued in Chapter 10, which is about vaccines, which can save lives by preventing diseases. Then the 11th chapter discusses how proper nutrition can prevent diseases. Chapter 12 is about emergent problems and possible solutions. This includes the flu epidemic, Ebola virus epidemic, global climate change, a shortage of medicines, genetic engineering, and stem cell therapy. It also describes briefly new drugs that have been approved by the FDA and regulatory agencies of other governments since the publication of the first edition. Chapter 13 is about the biology of information flow, receptors, and signaling. When these go wrong, it can lead to serious diseases, especially cancer. The book finishes with a chapter on systems biology, autopoiesis, and network theory, which are at the heart of predictive, preventive, personalized, and participatory medicine, also known as P4 medicine.